From the studios of Tucson Business Radio X, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
Innovations in cardiac care that can save and improve the lives of thousands of children worldwide. It's my topic. You know, I was sad to learn that 1 in every 120 babies in the U.S. is born with heart disease. And February is Heart Health Awareness Month, just in case you didn't know. So we are fortunate to have Jonathan Chen, MD. He's Chief of Cardiothoracic Surgery in the Cardiac Center at the Children's Hospital of Philadelphia, affectionately known as CHOP, C-H-O-P, where the Cardiac Center at CHOP cares for babies prior to birth, infants, children, and young adults with congenital and acquired heart conditions. Welcome, Jonathan.
Thank you. Good morning.
Well, the birth of a child is a joyous occasion, isn't it, for an entire family? But for the families of more than 40,000 American babies born each year with congenital heart disease, the CHD, it also brings fear and uncertainty. Dr. Chen, let me ask you, there are multiple types of congenital heart disease, and for those parents whose children do have a heart condition, they may not be fully aware of the various treatment options. Is that right?
Yes, that's right. Yeah. It kind of depends on the congenital heart disease has a broad range of severity. So to some extent, it depends on the severity of the heart disease. So many of these kids will be born with heart problems that they will either resolve on their own or they'll kind of outgrow. And so I think it's hard sometimes to contextualize all that. Other kids will need procedures within the first hours to days of life and anywhere in between. So, I think people should be hopeful about this, but I think with the, if you or your child does have the diagnosis of congenital heart disease, it's important to see a specialist.
The cardiac catheterization is a procedure that can be used to both diagnose and treat many heart conditions. It's a very specialized procedure, isn't it, Doctor?
Yes, and in particular in children, yes.
Yeah, well, 1 in 120 babies is born with heart disease each year in the U.S. That's a lot of bubbas, isn't it? 40,000. What encouragement can you give to my future moms out there?
For mothers out there, an important thing to remember is while this is it is the most common birth defect, meaning it affects about 1% of the population, most of those kids will do well, and many of them will not need any intervention over their lifetime. The other important thing to remember these days is that fetal diagnosis, meaning the ability for us to understand and counsel families, can usually be performed as early as 19 to 21 weeks gestation, so very early in pregnancy. And with that has come the ability for us to talk through with parents what to expect, and also to from our side, plan for any of the problems that or interventions that could have to happen once the baby's born. So all these things mean that we're really better poised to take care of these kids as newborns.
That's good news. Doctor, congenital heart disease is approximately 60 times more prevalent than childhood cancer, and about 25% of babies with CHD have a critical form and generally need an intervention during their first year of life. And the Cardiac Center at Children's Hospital of Philadelphia team performs more than 850 pediatric heart surgeries a year, including open heart and closed heart procedures and heart transplants. That's quite an achievement, is it not, Doc?
Yes, we're a very big program. We're probably one of 5 in the United States of this size.
Wow, it's amazing. The good news is that 85% of babies born in the U.S. with CHD now live to at least age 18. And, listeners, heart.chop.edu, we'll come back on it, but this is something you should have a good look at and a good read. Everything's on that site, right, Doctor?
Yeah, that's right. It's a good place to start for certain. It has a lot of educational information and also some resources as to for specific problems where else to look.
Dr. Chen, do we know why more than 40,000 American babies born each year with congenital heart disease? Is there a specific clue that you see?
We think that it's genetic insofar as brown hair and blue eyes is genetic, but we do not have a specific gene, for example, that we think causes congenital heart disease. That's probably the Nobel Prize 2045 is trying to figure that out. What we do know is that many things do influence. If you do have congenital heart disease, will influence your health once you're born. So, for example, we're increasingly understanding that the maternal fetal environment, as they say, so moms who smoke or have diabetes, that can impact the baby's health, in particular the babies with congenital heart disease, as they develop in utero.
Mm. So how are heart defects treated?
Again, it kind of depends on the severity of the heart problem. So many kids will be born with heart defects where we will just watch or maybe manage with medications and see whether they can grow older, grow out of them, whether the defect can get smaller. Some of the kids will require a procedure as a newborn, and that could be either a catheter-based procedure or an operation. And then, as we were saying before, they can require any number of procedures at any timing thereafter from birth to adulthood.
Wow. February, guys, is Heart Health Awareness Month, and we're lucky enough to have Dr. Jonathan Chen, MD. He's Chief of Cardiothoracic Surgery in the Cardiac Center at the Children's Hospital of Philadelphia. Now, Doctor, I do want to ask you this. Just explain to us again, if you wouldn't mind, what is a cardiac catheterization, and are there different types?
Yes, so cardiac catheterization is something that is done in kids and adults, and it's a procedure in which a tiny catheter is placed all the way up through the vessels into the heart. And this allows us sort of three important modes of information. One is that it can show us the anatomy. So, for example, if we're doing an operation, it will give us the roadmap to what we're doing. It can also measure pressures and flow inside the heart, so it can tell us a little bit about what we say is the physiology, so how the blood goes around inside the heart. And finally, they can actually perform interventions with catheters, so they can stretch open with a balloon or stent open areas that are too small. They can close structures that haven't closed but should be closed. And also in the older kids, they can actually implant artificial valves with a catheter, so a transcatheter valve, much as Mick Jagger, for example, had a transcatheter aortic valve about 6 months ago.
Oh, really? So it doesn't stop him, flipping around the stage, does it?
That's right, exactly.
So what is the expected long-term outcome for babies who undergo a cardiac intervention?
Again, it depends on the severity, but on balance, the outlook is very good for these kids. So those who have sort of what we would refer to as sort of the one and done, have a simple problem that we tend to have corrected, those kids will go on to basically a completely normal life. Those kids who will need several operations may not have as limitless an exercise capacity, but by and large, most of these kids do very well after this.
So what do you think about the future for cardiac treatment and interventions? Looking good?
Yeah, the future is bright. It's we are beneficiaries of advances in technology. So the better it gets, and with the sort of better, smaller, earlier we can intervene. And then I think also a challenge for us as we look toward the future is going to be individualizing our actual techniques and operations and procedures for each kid. So as we get into 3D printing and virtual reality, we can really get a sense of the uniqueness of each heart and how we can best treat the heart disease.
Wow, technology today. I mean, how did you guys ever do anything before?
Yeah, you'd wonder.
It's amazing. And, the miracles you perform, but I guess there must be a little bit of a sad side for you when you lose a few. I mean, how does that affect you?
Well, it's always very profound when when the operations or procedures are not as successful. And, I think our obligation is to, in those instances, is to always learn from each one. So understand what we could have done differently and whether we can do anything differently. I think when we look at our challenges in the future, we do focus on the areas in which we've made the least progress. So what are the biggest challenges, you may ask, often comes down to what are the specific problems for which we have very ineffective solutions at this point. And there's certainly a handful where those are the real final frontier.
Amazing. Well, God bless you, Doc. Keep up the wonderful good work that you do. And we want to get as many listeners as I can onto heart.chop.eu. That's www.heart, HEART.CHOP, CHOP.EDU. And there's plenty of stuff to read on that, right?
That's right.
All righty. Well, thank you, Dr. Chen. It's been a pleasure having you on the Mark Bishop Show on the Business Radio X network across America. Good luck with your future there.
Great. Thanks very much.
You're welcome. That's Dr. Chen. His clinical research has primarily been directed towards surgical issues in complex congenital heart care and cardiac transplantation, but focusing on advances with operative techniques, outcomes research, and transplantation for congenital heart disease, with a particular emphasis on the development of mechanical, ventricular, assistant devices for children, as well as stem cell-based valve conduits for pediatric application. Boy, is that a mouthful. Don't they do a fantastic job? That's amazing. I hope you enjoyed that, Dr. Jonathan Chen. It'll be on the network for some time, and we'll have you back here soon for another exciting episode on The Mark Bishop Show.